The disparities in diagnosing and treating CCCA have absolutely worsened during the COVID-19 pandemic. I believe this is really due to two factors. Number one, for a long time, patients were nervous about venturing out of the house, especially to go to a doctor's office setting or a hospital setting in order to receive diagnosis and treatment. And of course, we know that we've seen disparities in terms of health outcomes to COVID-19, with Brown and Black people being especially subject to worse outcomes in terms of morbidity and mortality. So the very people who need to be seen for diagnosis and treatment of CCCA are the very people who are at higher risk for worse outcomes from COVID. So people just didn't want to come in. In addition, we've seen more hair loss than ever these last few years due to the pandemic. People who have had COVID-19 often end up with hair loss, a different form of hair loss called telogen effluvium from the illness. And for some people, the mere stress of the pandemic has also caused telogen effluvium. Telogen effluvium is very different than CCCA. It tends to be a sudden onset, rapid loss of telogen hairs with no damage to the follicles. But it's very disconcerting for patients because it happens so suddenly and it can be quite traumatic. And so what has happened is, because we're seeing so many people with COVID-related hair loss, the underlying CCCA sometimes gets missed. So those are two ways that the pandemic has contributed to the disparities in identifying and managing CCCA.